The COVID-19 pandemic presented significant challenges in health communication.
The first one at the top of the list would probably be the uncertainty and the fact that there was so much that was unknown, and that induced a lot of fear. The second major issue was once we started to get our handle around what the nature of the virus was and how to deal with it, there was a lot of fluidity in the recommendations that were being made to protect yourself and your loved ones. And the third major issue communication-wise was really the impact of social media and how it spread anxiety and fear, which capitalized on number one or number two.
Critics point out the inefficacy of a one-size-fits-all messaging approach.
A lot of people in the middle of the communicative process, we're talking about local health leaders, felt like they had to parrot what came from the CDC or that came from the White House task force, and that parroting actually may have caused less trust in the government locally as well as at the federal level.
Could a better strategy have made a difference? Let's explore the power of message framing. Message framing is crucial in communication. It's not just about what you say, but how you say it.
If you walk into a store and you see a product that says 80% fat-free, and you see next to it a product that says 20% fat, 90% of the people will go for the fat-free one because the framing is around something that is positive, which is being fat-free for products. Yet they are exactly the same. So I think of a frame as a viewpoint or a schema that helps people respond to ambiguity, confusion, even conflicting advice. And it's usually driven by hidden ways of thinking about things, oftentimes by hidden biases.
If you understand your audience, it all starts with analyzing the audiences that you're targeting, and then decide, you know, what's going to reach them, and then how do you reach them. The way information is presented can significantly influence audience response, especially during crises like the pandemic.
When a doctor or physician talks to somebody, they have to use the language that's colloquial to the individual and not use the technical language.
Message framing affects cognition. During the pandemic, messages were often framed as absolute science, ignoring its evolving nature. This approach led to confusion and public mistrust. Loss framing was also often used. Loss framing highlights risks or what you'll lose if you don't comply. Loss framing during the pandemic frequently led to fear and resistance. Statements such as wear a mask or face the consequences, or get vaccinated or pay the price, emphasize negative outcomes, which can backfire in public health messaging. In contrast, gain framing highlights the benefits from taking an action and promotes positive actions. Messages such as mask up, save lives, or get vaccinated and protect your loved ones encourage cooperation and a sense of community, leading to a better public response.
So instead of trying to scare people, it's better to focus on the gain framing messages.
Research shows that gain-framed messages are far more effective in persuasion. Tailoring messages to specific audiences is crucial. A flexible audience-specific approach is more effective than a generic one. Audience segmentation is something that all communicators should be familiar with and should be doing, not during the crisis, but ahead of time.
And you would have identified immediately, if you had worked with those segments or those communities, communities within the communities, if you will, about who they trust and what kinds of experts they're going to trust and who they're not going to trust. And so you wouldn't have destroyed the credibility by putting people out there or putting messaging out there from people that don't have credibility with particular communities.
By adopting gain-framed messages, health campaigns will achieve more successful strategic outcomes.